If you're suffering of a lower back condition like an L4, L5 disc bulge or an L5S1 disc bulge, or low back pain or leg pain like sciatica leg pain, and you've been struggling to find out what's the best rehabilitation program or rehabilitation path to improve your back and improve your life, well, in this video, I'm going to break that down for you and tell you what I believe is the best strategy to help with a chronic low back condition. And be sure you watch right to the end because I have a very special gift to give to you when you watch right to the end. Hey there, it's Dr. Walter Salubro. I'm a chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving tips and strategies to help strengthen and stabilize the back. So if you're struggling with your back and you're looking to improve your back so you can bend, move, and lift better and live a normal life, then subscribe to this channel by clicking on the subscribe button below. Tap on the notification bell. Plus, tell me in the comments below that you subscribed. I love to see that, and I'll personally reply back to you in the comments when you say I subscribed. Now, finding the appropriate treatment program for a chronic back condition can be very daunting, especially when you've tried lots of things and they just haven't worked for you. I've heard this over and over and over with my patients that come to the office. In fact, many patients that come to my office have already tried all sorts of therapies, have tried other treatments, have tried medications, and if they worked, they would not end up in my office. But they're looking for something different, and that's why they show up. Now, one of the things that I recommend when it comes to a chronic spinal condition is a full examination and spinal analysis of the spine. So here's Mike the spine, right? You want to examine the spine and see what the alignment looks like, particularly on an x-ray, and match that up with posture, plus do other tests and orthopedic tests and range of motion and neurologic tests just to make sure everything is checking out. On an x-ray, what I'm looking for is a straight spine from the front and 3 natural curves from the side. Now, if there's a deviation of those natural curves from the side, then that's an abnormal spinal alignment, and it has consequences on not just pain and inflammation, but on limitation, disability, and poor quality of health in the long run. So one of the main things that you should be looking for is a structural rehabilitation program, a program that works on correcting the abnormal structure of the spine. So structural rehabilitation, corrective care. That's one of the things we offer in our office is corrective chiropractic care. So you improve the alignment of the spine and reduce any abnormal loads from any bad spinal positions. This in and of itself can make a massive difference in improving the underlying problem that could be leading to the symptoms that someone may be experiencing with their back or legs. Now, the next thing that's necessary is matching the spinal correction with posture correction. That's often missed in a lot of people. So the spinal correction is working on spinal adjustments, tractioning, setups to help improve the alignment of the spine. Posture is working on the global position of the body in space. Those should be married together. Very, very important. In fact, it's one of the predominant methods in chiropractic biophysics, or CBP, which is the main technique that I use in my office for corrective care. Once we work on the structural alignment of the spine and get that position properly, or at least better, then we start working on other aspects. And there's 4 things that I add in terms of our exercise program that you should be aware of. Number 1, we want to work on mobilization, getting the spine mobilized, whether it's local mobilization or mobilization type exercises. Number 2, we get into stretching. We need to find out where the tight muscles are, whether it's the hamstrings or quads or iliopsoas muscle or even the lower back. So several different stretching exercises that we can apply to a lower back condition. Number 3 is strengthening and stabilization. Bird dog, extension, Superman, side planks, prone planks. These are all different exercises that can help stabilize the spine once the underlying structural problem has been stabilized as well. And number 4, an often missed one is balance training. Balance exercise. We get people to do single line walking like tandem walking or heel toe walking or even single leg stance to fire the proprioceptors of the body, of the joints of the legs, hips, spine, and that sends good information to really bring everything home neurologically from a spinal and neurologic perspective. So those are the main components that I would recommend to look for. Again, let's review. Structural correction of the spine. Very, very important. Exercises, stretching, mobilization, stabilization, core exercises, and balance training. Now, there's a couple of things that I want to offer to help to make a difference for you. Number one, if you're looking for a corrective care, structural care type chiropractor, and you don't know where to find one, message me in the comments below, and I'll refer you to a corrective care chiropractic biophysics doctor directory where you can find one, hopefully in your area, by punching your address, zip code, or postal code. Number two, I have a very special gift for you just for being on this channel. And this is exclusive for my subscribers. So what this is my new lower back exercise guide, how to mobilize, strengthen, and stabilize the lower back. It's a downloadable PDF with 21 exercises. It's divided into 4 main sections that I talked about: mobility, stretching, stabilization, and balance. And it comes with step-by-step instructions in terms of sets, reps, when to do them, how to do them. Super valuable, and I give it to you as a gift for you, and it's exclusive only to my subscribers. How do you get it? Look in the description below. There'll be a link. You click on the link, enter your email address, and then click on the submit button, and then check your inbox, and you'll get this delivered right to your inbox as a gift exclusive to my subscribers. So I hope that you found this video valuable and that it may help to guide you in the right direction when you're looking for the right care for your back problem. And as well, be sure to get your lower back exercise guide by clicking on the link in the description below.